Hello guys, we are going to study about bacterial diseases in cattle. First, the disease hemorrhagic septicemia (HS). What is the synonyms? Pasteurellosis, because it is caused by Pasteurella maltosida, a bacteria, gram-negative bacteria. Synonyms: pasteurellosis, shipping fever, gut surf. What is the definition of this? It is an acute means suddenly, acute, infectious disease of cattle, buffalo, sheep, goat. Means it is an acute infectious disease of ruminants. It usually occurs during extreme environmental condition, malnutrition, and long distance transportation. It generally occurs during rainy season. The disease is enzootic in India. Enzootic means in a specific area. Enzootic. It is in rainy season and it is enzootic in India. Etiology. It is caused by Pasteurella maltosida. Pasteurella is a gram-negative bacteria. It is caused by Pasteurella maltosida, which is bipolar organism. Transmission. The disease spreads through ingestion of contaminated feed and water. Inhalation. Through inhalation and ingestion of contaminated feed and water. What is the symptoms? Symptoms, that is high fever, loss of appetite means anorexia, suspended rumination, dullness and depression, rapid pulse and heart rate, profuse salivation, saliva secretion more and more, lacrimation means discharge from eye, lacrimal discharge more, congestion of mucosa, profuse nasal discharge, discharge from nose more and more, difficult snoring respiration means at the time of respiration there is a sound producing, that is snoring type, like snoring respiration. Swelling of throat region, that is submandibular edema. It is the most important symptoms you can see in buffalo. And cattle mostly. Swelling of throat region. Recumbency and death within 10 to 72 hours. After complete of symptoms, then we have to see the diagnosis. First, the anamnesis, that is the history, that is season, climate and stress factor are there. Symptoms, from symptoms we can diagnose, that is high fever and swelling of throat region. Dyspnea means difficulty in breathing. Postmortem findings: hemorrhages throughout body and submandibular edema. In postmortem finding, you can see the submandibular edema, means edema seen in throat region. Examination of blood smear and smears from edematous fluids. Isolation of organism from blood and edematous fluid. Treatment is effective if given in early stage of disease. What is the specific treatment? There is the antibiotic treatment we can provide, that is the injection enrofloxacin. Enrofloxacin is the antibiotic at the rate of 2.5 to 5 mg per kg intramuscular daily for 3 days. Any antibiotic we can provide 0 days, 3 days, 5 days, 7 days. Then another antibiotic, if this antibiotic is not available, we can provide injection sulfadimidine at the rate of 150 mg per kg body weight intravenous daily for 3 days, or injection oxytetracycline, that is antibiotic at the rate of 10 mg per kg body weight. It is intravenous or intramuscular daily for 3 days. These three antibiotic, one of the antibiotic we can provide. And after treatment of antibiotic, any of the antibiotic, then we can provide supportive treatment. Use of antipyretics means the injection which can, antipyretics means control the temperature, that is the Melonex or Vitalgin. We can provide injection Vitalgin 20 to 30 ml IM. Use of antihistamine, injection Avil, Cadistin or anhistamine, that is the same name, that is the trade name. 5 to 10 ml IM. And we can provide fluid therapy also, injection dextrose normal saline IV. Next come to general measures, that is the control. In control we can take the general measures and vaccination. General measures: isolation and treatment of the affected animals, close animal markets, cattle, shows, etc. Burning or burial of dead animals. Means first the isolation and treatment of the affected animal. First we have to isolate the affected animal and treatment. Close animal markets and cattle shows, etc. we have to avoid that. Burning or burial of dead animals, it is the, we have to burn the animal, or burial means inside we have to bury that animal. Proper disposal of contaminated feed and water. Disinfection of cattle shed, we have to disinfect the cattle shed. Avoid long distance transportation and exposure to extreme weather. Then vaccination, there is the alum precipitated hemorrhagic septicemia vaccine at the rate of 5 ml subcut every year before monsoon. Before coming monsoon period we have to provide that. And this immunity last for 6 months. Yes, this immunity develops in 2 to 3 weeks and lasts for 6 months. This is all about hemorrhagic septicemia, and we can see you can here see the buffalo, that is the enlargement of the throat region, that is the mandibular edema, it is seen, and it's enlargement of the throat region, and it is seen like depression, high fever and swelling of the throat region. These are the signs of hemorrhagic septicemia. Here you can see the vaccination bottle of hemorrhagic septicemia. That is the 50 dose. It contains 50 dose. Contains formalin killed. It is the important killed bacterial adjuvants. It contains killed bacterial adjuvants with aluminum hydroxide gel. Inject 1 ml per dose subcutaneous route in cattle, buffaloes, calves. Okay, this is the things we have to remember. Killed bacterial adjuvants, killed bacterians, not attenuated. It is killed bacterial adjuvants with aluminum hydroxide gel. We have to provide in subcutaneous route. Okay, thank you.